Hi guys, Happy New Year. I hope that 2024 is better than 2023 and we would have learned from 2023. Trust in God, put in your work, big things must happen, yeah? So, my name is Kira Isidore, registered nurse in Barbados and the UK. And previously, no transitioning, still in the transition mode. I've just completed my Osce. And I just wanted to, as I would have said before, just go through some stuff, anything that I think would help anybody when they were looking to transition like myself. I remember doing so many searches on YouTube to find help with basic stuff, like even like building your credit score. Like nobody told you that when you come down here, it's going to be so difficult to maybe even get an apartment. So there's so many little things that you need to bear in mind when you want to make that final decision to transition. And I would not tell anybody not to do it because it is for anybody that wants to try it. It's not a death sentence or a life sentence. So in the event that you tried it and you didn't like it, there's always home. Yeah, but I just think the more you know, the better you are to prepare yourself for the transition. Yeah. So please excuse my voice. I'm a bit hoarse. I had a wonderful weekend. Went to Manchester to visit my friend and I had a good time. So again, I don't work weekends and holidays. So I had a lovely weekend. So let's get into this Osce. Yeah? I wanted to give you guys a idea of how the Osce is made up, right? So in my previous videos, I would have said 15 clinical stations, but it's actually about 21 stations, yeah? And I will go through them so you have an idea. Again, all the information for Osce is based on the NMC website. They have, and there's so much information on YouTube. Breakdown, they got so many people on YouTube trying to explain the same thing in different ways, So you just need to follow NMC's marking criteria. They're providing marking criteria. With that marking criteria, you know exactly what needs to be mentioned in that skill or, that station. So for instance, if you're doing assessment, there's certain things that they'll be listening for. They want to hear you describe that respiratory rate. Don't just say 18 beats per minute. They want to know if it was regular, how the rhythm was, and the depth. They want to hear about respiratory sounds, rattle, wheezing, stridor. So them is things that when you get the marking criteria, although you might know how to do the skill, you gotta remember you can't leave out these things. Yeah, that's pertinent information. But again, to give you an idea of how the Osce is made up, I would just mention it now, but I will need to do another video where I will go through assessment with you, planning with you, implementation, evaluation, which is API. The thing about API is in the exam, that would be considered 4 stations. Assessment is a station, planning is a station, implementation, which is drug administration, is a station, and evaluation, which is handover of the client, that is a station as well. So that's 4 stations, which is not bad because we know API, we've been doing that from, school. Whether you did auxiliary, whatever, you would have known about assessments, stuff like that. So it's just how to do it and what they expect, right? It's not so much the skill, it's how they want it done. And that's where you gotta practice and what you have to learn in order to deliver and pass. Yeah. So once you master it, the skill part is minor. So the Osce basically is made up of 10 stations, as I told you, 4 of them being API. That's assessment, planning, implementation, evaluation, 4 stations done, right? So obviously that will go according to the condition that you have. As I said, if you get a person that had subdural hematoma, head injury or anything like that, you would need to do a GCS score for them. So you would need to do a GCS assessment within that assessment. And there's no extra time allotted because you got to do a GCS. So you got to master the assessment with the basic new score. You got to try that as a 20-minute station, but you need to try to get that done in at least 15, 16 minutes so that in the event you come up you get one that you have to do an extra exam, like the GCS, or there's the news too. There's the GCS. There's a MUS, which is a nutritional assessment, and there's also a PH C9, and there's also a six CIT exam. I will tell you about that later, just to give you an idea, right? So that APA is 4 stations. Then you got clinical skills, and you have to choose 4 from these. Is 4 of these that you will be tested on. So you could get something like in hospital resuscitation, which is a 6-minute station, and that's I was afraid of that initially, but by the time you get through all of these skills, you will be praying to get that. Yeah. You got things like fluid balance, you got oral care, you got bowel assessment, you got nutritional assessment, you got removal of the urinary catheter, you have catheter specimen of urine. So that's just a urine collection sample. But there's a technique, is a way to do it. Certain things that need to be said, need to be done. Peak flow, peak flow rate, which is what I have gotten in my exam. Then you got administration of inhaled medication. I got that as well. You got administration of suppositories. You got blood glucose monitoring, subcutaneous injection, wound assessment, and antiseptic non-touch technique, which is a very technical one. But I think if you understand it and you remember your hand hygiene, you covered. You got pressure area assessment. I think I got that one as well. Pain assessment, that's one that everybody needs to know. Midstream specimen of urine and urinalysis, that's the MSU urinalysis one. That's a little tricky. And then you got IM, intramuscular exam, injection, sorry. You got fine bone nasogastric tube, where you got past the NG tube, and this is done on a dummy, so you don't gotta be afraid. Nasopharyngeal suctioning, that's not bad. And then you got oxygen therapy, pretty easy skill. And then you got visual infusion phlebitis, and with that one, you do a intravenous cannula flush. So those are the skills that you would have to choose. Not you would have to choose, that you would be given 4 to do. Then after that, you would have the professional values that I would have mentioned, and that's a written station, and that could be under topics like bullying, falsifying observations, and basically how it goes is like what you would do if you see something unethical being done, like somebody was writing wrong observations for a patient, and you realize. So obviously, first thing first, you will let them know that it's not the right thing to do, and then you would do obs on that patient to get the correct readings and the correct obs, and to see, make sure the patient is safe. If anything is wrong, it needs to be escalate. And then you need to report that person, because as a nurse, and you know the policies and the right things. If you don't report that person, then your registration could be at stake in the event that they find out that you would have known or whatever. So it's basically just steps in telling you what is expected as a nurse, and also following the NMC code of conduct. So I will give you an idea. We'll go through them with you, maybe not all, because there are like 15 of them. I would got to check to see how many. You only tested on one. Yeah, so the thing is, you gotta learn all, because you don't know which one you will get. So you got an idea, but it's a lot of repetition. So based on the topic, then you would know, how to provide the information. And then you got evidence-based practice. So this too is also a written station, and it's another 15 topics, but then no, you only tested on one. So evidence-based is basically just information provided for you under the particular topic, and then they would ask you certain questions, and you would just pull the information from the answers from the information that provided. It's not a hard station. If I'm being honest, I didn't put a lot of emphasis on it because I was too busy trying to perfect the other stuff, And I think my evidence base was on bedside handover. I think it was. Yeah. I think my evidence base was on, yeah, I think, I can't remember, you know. Imagine I know do that exam. What my evidence base was on? Unless the add-on. Anyhow, I will gotta get back to you because I really can't remember what mine was on. None of these topics here don't look like mine. Okay. Alrighty, so yeah, that's basically the OSCE structure, you know, in a nutshell. Again, I don't want to make the videos too long, so I definitely will be back to talk about assessment. And remember, if you want me to go through anything, if you want to ask me any questions, just ask. You could private message me, you know, whatever, and ask me the question. It might be something that somebody else wants to know. And again, like when it was transitioning, so many things I wanted to know that was not there from somebody, at least in the Caribbean, you know. So it was just, you know, I think that is the main reason for me wanting to do these videos, you know. So I hope that it doesn't have to be a big platform, but just, you know, 1-2 persons, and I'm okay with that. Yeah, so thank you guys for tuning in, and I will be back maybe tomorrow to go through assessment with you guys, okay? And I will try to do a demonstration on how assessment goes. Okay, so have a good night.